Hello everybody, this is DMA's FMGE hack series and today we are going to talk about the pediatrics. So speaking about the pediatrics, the very high yield area is your growth and development and followed by the neonatal resuscitation, followed will help you in understanding the better in understanding. Okay. Now speaking about the growth and development, the normal growth and development, four aspects of your milestone. Milestone is one of the area of interest people because in the milestones you may secure one mark, one complete mark. Definitely you may get it either from the normal milestone or abnormal milestones like a red flag signs. Okay, so understanding a normal milestone signs, so I help you to read all those things. Features and management of failure to thrive, short stature, obesity, delayed milestones, and development disabilities are the things you have to remember. And then you have a nutrition and feeding. So speaking about the nutrition and feeding advantages, breastfeeding advantages, techniques and common problem, and formula feeding, what are the and feeding. So apart from that, the most common question they may ask you is when is the ideal time to initiate the breastfeeding? As early as possible. Previously they used to do that within a 48 hours, 24 hours, blah blah blah. No, as early as possible you have to initiate the breastfeeding. That's the current status. So you have to remember this type of questions. You may confuse it with the old Q banks. You may have a different answers, and you have to update yourself for this current FMG. Okay, and then you have the infectious diseases. Speaking of infectious diseases, which are all vaccine preventable diseases, recommended vaccines and schedule, contraindication and adverse reaction. This vaccination schedule and vaccine preventable diseases are, like you study that in the PSM, you can integrate with there. And common infectious diseases like childhood pneumonia, gastroenteritis, meningitis, sepsis, TB, and HIV infection in children are pretty high yield diseases. In terms of infectious diseases, you have to remember that. So we have talked about the nutrition, we have talked about the infectious diseases, we have talked about the like growth and development. So growth and development, nutrition, you expect two questions. If you are lucky enough, you may expect the three questions. And then vaccination schedule, you may call it as a pediatric question, or you may call it as a PSM question, but you expect one question here. And then you have the respiratory disorders, acute respiratory infections, where you see the management of your ARTA, URTA, and LRTA, which includes your croup and bronchiolitis and pneumonia. While chronic respiratory disorders such as asthma, cystic fibrosis, and bronchopulmonary dysplasia are the ones you have to remember. Acute respiratory and chronic respiratory infections and congenital diseases like laryngomalacia, and then you have this what do we call it, tracheoesophageal fistula are the another one you have to remember in those cases. And then apart from that, you have the cardiovascular diseases. Speaking about the cardiovascular diseases, congenital heart disease people, all left to right shunt, right to left shunt, all the congenital and PDA, all the congenital shunting diseases and PDA are pretty important, which covers you like a PDA, AST, VST, and tetralogy of Fallot. And you have this acquired heart diseases like rheumatic heart disease, Kawasaki disease, cardiomyopathies, and hypertension in the children are kind of like, acquired cardiovascular disease. These are the list of diseases that you have to remember in terms of cardiovascular system. All the shunting, PDA, along with that acquired one like rheumatic, Kawasaki disease, and the cardiomyopathy and hypertension in children that you have to remember in terms of cardiovascular disorders. And then you have this neurological disorders. Speaking about the neurological disorder, which could be a seizure disorder, epilepsy, febrile seizures, status epilepticus, so juvenile infantile spasms like a West syndrome, Leynold-Gastaut syndrome, and you have this epilepsy, types of epilepsy, and then febrile seizure, and then status epilepticus. All these things will be covered in the neurological disorder. Apart from that, you have the behavioral disorders, which you see it in the development, like autism, ADHD, and cerebral palsy are the things, like you have to remember. And then you have the headache, a type of a headache, and diagnosis and management of your common headaches in your children are pretty important. These are the neurological diseases you have to remember. One is your seizure disorder, another one is your developmental disorder, or the high yield area and topic of interest in terms of your neurological disorder. And then you have the genetic and the metabolic disorder. Speaking about the genetic and the metabolic disorder, people, all the inherited metabolic disorders like glycogen storage disease, lysosomal storage disease, protein malfunction, or amino acid disorders like phenylketonuria, like alkaptonuria, maple syrup urine disease. And then you have this, apart from that, you may have this, tyrosinemia, and then you have this all these amino acid respective diseases. Along with the amino acid respective diseases, you may have to know about the lysosomal and the glycogen storage diseases like Van Gierke's disease and the Core's disease, Anderson's disease, and you have this myophosphorylase deficiency, which is so called as McArdle's disease. And all of this, like inherited metabolic disorders are to be studied in separate. And apart from that, you may also have to study genetic disorders like just trisomy, monosomy, and you have this Turner syndrome, Down syndrome, Klinefelter, all of them. So everywhere you may expect to see one from the trisomies or the chromosomal abnormalities, and one from the inherited, like a genetic disorder. You can call it as biochemistry, or you can call it as genetics, you can call it as pathology, or you can call it as pediatrics. But you may see one question in this area. This is quite a 7-star rated topic, people, that you should not miss. And apart from that, these are the regions where you expect to see the 70% of the pediatric question. So growth and development, inborn errors of metabolism, genetic disorders, and you have this neonatal resuscitation program. The next area is your neonatal resuscitation program, NRCP, NNRP, neonatal resuscitation program. And apart from that, you may have this systemic diseases. And prior to the systemic diseases, breastfeeding and formula feeding are the high yield areas of your pediatrics, while rest of these things will be covered somewhere in the medicine or pathology at some point. So you need to focus only on this pediatric specific areas to score a very high marks in the pediatrics, people. So anyways, this is all for the pediatrics, and thank you for watching the video. We will come back to the next session soon.